I am Dr. Meera Sethi, Senior Consultant in Tiratnam Hospital. I am practicing for more than 30 years. I will be talking today on PCOS, which is very common nowadays in reproductive age group and adolescent girls. Coming to the syndromic approach of PCOS. PCOS comprises of triad of anovulation. There is excess of male hormones, and by the ultrasound we can diagnose polycystic ovary. Two of the three symptoms should be there to diagnose a girl with a PCOS. Prevalence is 5 to 10% in reproductive age group girls. The cause of PCOS is merely unknown. It can be genetic or environmental. Genetic means if one of the siblings or there is a family history of PCOS, the girl is more likely to have PCO. Coming to the causes of PCOS. What causes PCO is not very important, but the long-term sequelae are very many. So, as soon as it is diagnosed, the help of a doctor should be taken for it. How to diagnose PCOS? By the history, there is prolonged and delayed cycles. The girls, they menstruate at least 9 times in a year. There is delayed periods, can be sometimes delayed by 2 to 3 months. And once the period comes, it can be very heavy. Scanty flow also is found in some of the cases. There is history of excessive weight gain, and the weight is very difficult to lose. It can be acne, excessive hair growth over unwanted places like chin, facial hair over the body, chest, back, and arms and legs. The scalp hair are sparse and thin. To diagnose PCO, we have to take a history, detailed history, to examine the patient for extra hair growth, to check BP, weight and height of the patient, to calculate BMI, to diagnose how much obese is the patient and how she will lose the weight. Symptoms are again, there is excessive weight gain, there is problem in the menses, delayed menses or scanty flow, acne over the face, depression, mood swings, and there is long-term sequelae of that the patient is not able to get pregnant. How to treat it? We have to do certain tests to make the diagnosis. Lab tests are required, blood tests like blood sugar levels, serum insulin, FSH, LH levels, serum testosterone levels, and according to the lab test, we manage our plan of treatment. Pelvic ultrasonography is required to see the cyst in the ovaries, the volume of the ovary, and the capsule of the ovary, thickness of a stroma and everything. Treatment mainly depends on lifestyle changes and medical treatment. Sometimes only the surgical treatment is required. Lifestyle changes include losing the weight, which is more important. At least 10 pounds of weight should be lost. It brings the hormones in balance and the cycle also becomes regular after losing weight. Diet is a very important factor. The person should take healthy diet which is friendly to heart like green vegetables, fruits, whole grains, avoid fat and fried food, cheese and non-veg, vegetarian diet. Medical treatment is metformin to control the hyperinsulinemia and insulin resistance, cyclical hormonal therapy for regulating the menstrual cycle, and anti-androgenic drugs for excessive hair growth and acne. It takes time for excessive hair growth and acne to get cured because the hormone levels take at least 3 to 6 months to be in balance with the medicines. Extra medicines for this can be taken in the form of antimicrobials and topical retinoids. Coming to long-term sequelae, these are diabetes, hypertension, cardiovascular diseases, hyperlipidemia, endometrial cancers and hyperplasia, acanthosis nigricans, and for this, the patient should be in regular follow-up to avoid long-term sequelae and to assess how much the treatment is working. Regular lab tests and ultrasonography are required to see whether patient needs any change in the treatment or the treatment is working. Thank you so much.